We're here to spread the love of Christ through quality health care to those in need. And we define those in need traditionally as being people who are under 200% of the federal poverty level but just don't have the health insurance. So they really have nowhere else to go when it comes to providing for preventative care or when they're sick and they need chronic medication. Good Sam got started because a pastor named Grant Cole was noticing that when he did benevolence ministry in his church, that a lot of the people that were coming and looking for money for electric bills or food or rent, the reason when he started asking questions, why did you get out of budget, what happened, the top two things that popped up were medical bills and their car broke down.
A lot of people were working a job that was not salary. They did not have insurance. They would use the emergency rooms as a place to get health care, and as a result, it was throwing them out of budget.
Grant just started talking to people and trying to find out what he could do towards that, and found that there was a Good Samaritan Health Center in Atlanta run by Dr. Bill Warren. And so he set up a meeting with Bill, and before he went down, he thought, what should our mission statement be?
I went in my office and I wrote down a mission statement. And I wrote down to demonstrate the love of Christ by providing quality health care to those in need. I went downtown, met with Dr. Warren, walked in and I asked them, I said, do you have a mission statement? And their mission statement was to spread the love of Christ by providing quality health care to those in need. Only one word different, and actually I liked his a little better because the only reason we wanted to demonstrate the love of Christ was actually to spread it. So right in our first meeting, we adopted that mission statement, and after that happened, we began raising funds, and God began adding people, and then it was just amazing to watch how the community began to come together underneath this project. It was just a God thing.
So they brought me in about halfway through that capital campaign to start working on building the quality healthcare part, because that's in our mission statement. We don't want to just give out pills to people. We want to actually provide quality healthcare that anybody would want to come to.
Being able to come to a place, I've come with Cindy to each of her appointments, and just being able to talk to us at length and try to, help us make the best decision we could, but at the same time allowed her to make the decision herself as to which course of treatment she wanted to take. They didn't just say, oh, this is what you need to do. Just really, it's a great atmosphere too when you're, it's not the most fun in the world to have to go to the dentist for anything. But when she's come, I know she's actually maybe doesn't enjoy the actual dental work, but aside from that, it's just it's really just enjoyable to be here and to talk to the people that work here.
One of the things that makes us unique, I think, is just the fact that we really emphasize the first part of our mission statement, which is to spread the love of Christ. And so we want to create an environment that people can really feel loved and respected as people who are made in God's image.
A experiência que eu tive também foi com minha esposa, né? A minha esposa necessitava de uma cirurgia. Ela tinha uma pedra, né, no pescoço.
Another time that they also helped me was with my wife. She's also a patient here, and it came to the circumstance where she had a cyst on her neck, and the Good Samaritan first diagnosed it, and they then referred her to Kenneth Stone so that she would get that cyst removed from her neck. And it's again another time in our lives where we weren't financially stable to get that procedure done without the help of the Good Sam.
People come in, and just as they come to have their physical needs met, we're there to help them meet their spiritual needs. And those ceiling tiles that we put together, made from the comments for Dr. Hansard, encouraging people to go to the prayer room and be ministered to. And it's like everyone there. It just seems like the atmosphere, people are so friendly. No matter how busy it is, it seems like everyone will take time to actually minister to a person's needs. it's a whole different atmosphere there, because it is actually an atmosphere of ministry, of caring about the whole person.
When you find someone or a facility or a practice where you get that level of concern and compassion added with the professionalism, it just makes for a really beautiful gift to the community.
I like to say, and I like to refer this verse to Good Sam, as for you, brother, do not grow weary in doing good. And this is something that they have been showing for their patients and towards their patients.
Nunca canse de fazer o bem. Nunca canse de fazer o bem.
Do not grow weary in doing good.